Today we are going to discuss some mnemonics in dermatology that is going to be very helpful in your exam preparation and remembering the important stuff. Let's start with the first mnemonic, that is drugs causing the pemphigus. The mnemonic is PCR. P stands for penicillamine or penicillin, C for captopril, and R for rifampicin. You have to remember that the most common cause is penicillamine or penicillin, and the drugs that are causing pemphigus, there is no antibody associations, and the drug reactions is due to biochemical interaction. In the case of penicillamine, the thiol group of the drug react with the thiol group of the desmoglein, causing the pemphigus. Next comes the drug causing psoriasis. The mnemonic is PLAB, P for painkiller and NSAIDs, L for lithium, A for anti-malarial and ACE inhibitors, and B stands for beta blocker. So PLAB is the mnemonic for drug causing psoriasis. Drugs causing SGS or 10, the mnemonic is natural and clear soap, natural for nevirapine and NSAIDs, clear for the carbamazepine. S stands for sulfonamide, O for oxychems, A stands for allopurinol, and P for phenytoin or penicillins. So natural and clear soap is for your SGS and 10. Next comes the drugs causing acne vulgaris. For this you have to remember the mnemonic pimple. Here the P stands for phenytoin, I for isoniazid, M for methylcobalamin, which is vitamin B12, P for progesterone, which can be remembered as OCPs also, L for lithium, and E for endothelial growth factor receptor inhibitors. If you extend it to the pimples, then S can be added as the steroid, which is an important cause of acne vulgaris. Okay, this is very important slide of the drug causing SLE. So the mnemonic is SHIP. HIP is highlighted and S is not, because sulfur drugs are not very frequent cause of SLE. Hydralazine, isoniazid, and procainamide are frequently causing SLE. To remember with the SLE drug causing, they are not associated with the antihistamine antibodies, and there is no CNS and renal involvement in SLE caused by the drugs. Apart from drugs, the important discussion is STDs also. The genital ulcers, which can be painless, which can be painful, it can be easily remembered, painless. Syphilis can be spelled as syphilis. So syphilis is painless. There is no pain in the ulceration. There is no pain in the lymphadenopathy. Along with syphilis, donovenosis is also painless. For painful ulcer, you can remember Haemophilus ducreyi, which is chancroid. For this, you can spell as Haemophilus do cry. So with the chancroid, you have to cry with the pain. So it's a painful ulcer. The next slide is very important examination question. Very frequently asked, the sequence of the changes in the Raynaud phenomena. This can be remembered as PCR. Here the P stands for pallor, which is mentioned as yellow color, C for cyanosis, which is shown as blue, and R for redness, which is red. So pallor is due to vasoconstriction, which leads to the decreased oxygen supply, and in return, which causes reflex vasodilatation. So these are the sequence of the Raynaud's phenomena.